Well, despite these kinds of testimonials, new polling shows the majority of unvaccinated Americans are unlikely to be moved in their thinking. According to a new AP NORC Center poll, 81% of unvaccinated Americans said they probably or definitely would not get the shot, just like 19% said they would likely get vaccinated. Joining us now is Dr. Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine and co-director of the Texas Children's Hospital Center for Vaccine Development. He's the author of the book, Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. Also with us, U.S. National Editor at the Financial Times, Ed Luce, and White House Editor for Politico, Sam Stein. I'll start with Peter Hotez. Listen, it might be, there's no kind way to say it. There is a political divide in this country that is now one side of this being isolated by a deadly virus. And with numbers that we've seen, 80% of people still not changing their mind of the vaccine. You know, your research on how to stop a pandemic or how to stop the next one, I wonder what it would take at this point to try and turn this around.
Yeah, Mika, you're exactly right. And, you know, it's no coincidence where this epidemic is raging right now. It's first and foremost raging in the South. If you look at the states with the lowest vaccination rates, those are the states that have an enormous amount of COVID. You mentioned Florida, but Louisiana is on fire. Alabama's on fire, Missouri, Arkansas. And these are all conservative strongholds. And it's not fun for people like myself to talk about Republicans and Democrats and conservatives and liberals, but that is the reality. This is months and months of anti-science, anti-vaccine aggression coming from the far-right elements of the Republican Party. And you saw it play out at the CPAC conference where they said this is nothing more than a effort for power and control, and they're going to use, first they're going to force vaccines on us, then they're going to take away our Bibles and our guns, and all of that disinformation, meaning deliberate misinformation, came out of CPAC, the conservative news outlets. And so when we talk about Facebook as the disseminator, I absolutely agree with Joe, but at the same time, we have to look at the sources of who's driving this. And what's driving this, first and foremost right now, are conservative groups. Now they're trying to make amends after they're seeing the monster that they've unleashed. But you know, this was not a one-off thing. This went on for months and months and months, and also targeting scientists as well. You know, they went out, of course, Tony Fauci and myself and several others. This was all a deliberate, coordinated war of aggression against science and scientists.
You know, Doctor, it's so interesting. It's not interesting. It's tragic that these times that we're living in have made obvious public health moves politically perilous. You hear people talking about vaccine mandates as if, again, we've had the Nazi analogies. We've had every other crazy analogy. They're going to take away our Bibles. I'm just curious, of the 300 million or so Americans that got like 5 or 6 vaccines before they went into kindergarten, did their parents have to trade in their Bibles before they got their vaccines? Did they have to trade in their Bibles when they were required, if they wanted to get a public education, to get vaccine for the mumps, to get vaccine for polio, to get vaccines for diphtheria, to get vaccine? I could name 5, 6, 7. You could have called them vaccine mandates, whatever you wanted to call it. It was a requirement. Show your papers. If you didn't get the vaccine, you don't get an education in the United States of America, except in extraordinary circumstances. So why can't we tell public school teachers, if you want to teach this fall, you have to get a vaccine? Why don't we tell frontline workers, healthcare workers? I mean, it's just a shocking number. 40 to 50% of healthcare workers that are working with senior citizens right now in nursing homes aren't vaccinated. Why don't we tell them you have to get a vaccination? This is a public health epidemic, pandemic, or you can't work. Why don't we tell our public safety officers the same thing? this would be no more radical than what we've been doing for 60 years. And let me just tell you, whether it's Facebook, if you want to blame Donald Trump, whoever we want to blame for this. People are acting like this has never happened before. There's something about these times when it comes to public health have made smart people dumb and dumb people insane. So why don't we have those mandates?
Yeah. I mean, the truth is there was never anything anti-vaccine or anti-science about the Republican Party. As I often say, the National Academy of Sciences was launched by Lincoln. Eisenhower launched NASA, and George W. Bush launched PEPFAR, the President's Emergency Plan for AIDS Relief. This is relatively new, and it began, and I know where it began because it began where I am here in Texas in around 2015. There was this new health freedom, medical freedom movement. Somehow the anti-vaccine movement, in order to re-energize, because a lot of us had defeated the fake links between vaccines and autism, they needed a new angle, and they got themselves adopted by the Republican Tea Party, particularly down here in Texas, under this banner of health freedom, medical freedom, and it just really accelerated after COVID. They started becoming defiant of masks and social distancing, and then now it's extended to vaccines. And what I say is, look, I'm not politicizing this. The bad guys are politicizing it. My job as a scientist is to call it out and say, look, this anti-science aggression benefits nobody. It's completely self-defeating for the country and for all the deep red states now where COVID is accelerating, and trying to understand how we delink it has to be a top priority. And I'm really worried because as bad as things are right now, it's about to get worse. It's going to get worse because schools are starting down here in the South in a few weeks. We start early here in August. And we've got 17, 16, 15% of the adolescents vaccinated in the southern states, 30 to 40% of the young adults. We've got the Delta variant accelerating. We have the number of the red state governors saying no mask mandates. What makes you think any of this is going to go well? We are going to see now lots of young people get hospitalized now in the coming weeks.